She's eating more?
Yes.
Dr. Chanel Rico tends to a 2-year-old pneumonia patient.
So are you feeling better today?
An all-too-common case on the Rosebud Sioux Indian Reservation, where Native Americans suffer from disease rates much higher than America's white population.
How long ago did you break it?
She works for the only U.S. government program that offers free comprehensive health care to an entire ethnic group, the Native Americans, who live both on and off reservations. The U.S. government's commitment to provide health care to the Indians stems from treaty obligations it's made with the tribes. But those treaties don't guarantee either the quality or full funding for that care. The government's own auditors say the Indian Health Service rarely provides benefits comparable to private insurance. And it actually spends less per patient than the federal government does on its prison inmates.
The real shortfall is the fact that there's not enough doctors. The few that we have are too overwhelmed.
You have to be like on your deathbed or going to lose an arm or a leg or an eye before they'll refer you out to a specialist.
But the new director of the service defends its performance given the funding it gets from the Congress.
For example, since the 1950s, we've seen reductions in infectious diseases and pneumonia and tuberculosis. However, we're a very small population. We're less than, we're about 1.5% of the population. And so we've seen that the budget just hasn't been able to keep up with the demand or need that we have.
He's not here today. He'll be back on the 5th.
And as a result, it's very challenging for us to provide care.
But advocates say they're encouraged by U.S. President Barack Obama's pledge to upgrade the service.
My budget proposes an increase of 13% in IHS funding.
Yet some of Obama's critics have highlighted the shortcomings of the Indian Health Service as an argument against his proposal to offer the option of government-run insurance to all Americans.
It's very unfair, but at the same time, we're kind of glad that somebody has sort of put us in the mix, even in an unfair position, because it gives us the advantage then to address those questions.
Whatever health care reform Obama manages to achieve should include improvements for them too, say tribal representatives.
There's all kinds of things that we've given up as tribes, and I think that they've well paid for any insurance that we as Native Americans would ever have to pay.
So often isolated from the mainstream of America, the country's indigenous people hope the nationwide focus on medical care can at least shrink the health gap between themselves and the rest of their country. Tom Ackerman, Al Jazeera in South Dakota.